Hi, Christine. This is my response to your discussion post. So, you mentioned an important point in your post in regards to medication for mental health disorders and the fact that many women will discontinue their medications when pregnant, which can increase some of their symptoms. Many mental health disorders, such as bipolar disorder, schizophrenia, schizoaffective, and depression, have to be treated with medication. And taking these medicines while pregnant or during the perinatal period, where they're breastfeeding, it may cause harm to the child in the form of birth defects. I can actually recall working with a client who was diagnosed with schizoaffective disorder, bipolar type, who always tended to be extremely violent and psychotic when she was pregnant. And she was often arrested for assaulting her significant other and threatening staff during her pregnancy. And it was determined by a doctor in court that because she was not taking her medication while pregnant, this was contributing to her behavior. She had to remain in a forensic hospital until she had given birth and subsequently placed back on her medication. And she eventually got better and she had a completely different personality. Creeley and Denton discuss how mental health issues might pose a significant risk to both the mother and the child, and that simply discontinuing or avoiding medication use during pregnancy may actually not be possible. If a woman is already struggling with mental health issues, the emotional and physical changes that they experience during pregnancy can definitely increase their symptoms, in addition to other factors that they might encounter when they're living in low and middle income countries that already have limited resources. In regards to postpartum depression and it often going unreported due to stigma, which can contribute to suicide, Patani stated that maternal mental health experts have discovered that women will often choose to struggle with postpartum depression on their own rather than seek treatment and having to risk their families being torn apart by the child welfare services or people thinking that they're unfit mothers. Although screening methods can be integrated in perinatal appointments to help this, if the mothers aren't reporting it, then it's difficult to prevent them from committing suicide and obtaining the help that they need. Thank you for listening to my post, and you have a blessed day. Bye.